Currently, Uganda has recorded 88 COVID-19 positive cases, with 52 recoveries and with no fatality. While Uganda is fortunate in that regard, a senior pathologist at Mulago Referral Hospital, Dr Sylvester Onzivua, says if any fatality happened due to the pandemic, the country is not prepared to handle these kinds of dead bodies.
We are not prepared. We are not prepared, and I think it's an area that has been ignored. And yet it should be one of the key things that we should prepare for. We are not prepared at all.
Speaking to us from the KCCA mortuary in Mulago Hospital, Dr Onzivua said his department cannot even handle 20 bodies in a day.
I think let us not go there, because we do not have the capacity to handle 50 bodies, 100 bodies. If the deaths occur like in other countries, 50, 100 per day, I think it would be a real disaster here.
Dr Onzivua adds that he is unaware of any government plan to manage COVID-19 dead bodies.
We have not, as a department, as an institution, not as a ministry of health, as far as I know. It may be there without my knowledge, but as far as I know, I'm not aware of any that has been designed.
During a recent address, President Yoweri Museveni directed that any Ugandan dying abroad should not be brought back into the country for fear of spreading the virus.
When somebody dies of COVID, don't try to bring the body back. Please, let the body be buried where the person died. Because the virus stays, on, they say can stay on this table for 5 days.
However, Dr Onzivua provides an expert opinion on the matter.
Well, I'll not interfere with the government policy, but all I'll tell you is that the dead body of somebody of COVID is not infectious if handled properly. It's not like the Ebola body. Ordinarily, it's difficult for this virus to be spread from a dead person to a living person.
But if somebody was to die, it would be the health workers to bury him, not the relatives. Am I correct?
Unlike the hemorrhagic fevers, where even the fluids are very contagious, this is not the case here. Oh yeah, the virus can actually remain alive in the dead body, especially in damp conditions, even up to 9 days. I think current literature says up to 9 days. But on average, 72 hours.
Dr Sylvester Onzivua has been a pathologist at Mulago Hospital and a lecturer of pathology at Makerere University Medical School since the mid-90s. Jingo Francis, NTV.